In healthcare and in our system, innovation is going to be key for us to think differently about how we provide care, or somebody else will figure it out before us. Why not us? Why not Intermountain Healthcare be leading edge and really make sure that we're implementing our clinical best practices and those principles behind clinical programs to innovation and new technology? As we come up with some new ideas, there is a need to tweak technology or optimize technology for those new ideas. Many of those concepts are best tested in a remote location, so St. George made sense from a system perspective to have a technology center where some of those things could be tested, technology could be developed, and once the tweaks are figured out here, we can deploy them to the rest of the system.
Utilizing the Technology Center, we're able to evaluate these different things, these different emerging technologies prior to putting them into a clinical environment. We can basically prove out whether or not they're going to work. And that not only saves a lot of time, a lot of money, but it also makes the care better for the patient because we know what to expect whenever we release it. Some of the things that we're working on in particular is we're working on the ability to, one, just expand beyond the walls itself. The other thing is once we expand beyond that, then we can actually monitor patients in their home environments. Once we can get them out of the institutions, get them home, then they begin to progress and they begin to get better a lot quicker. By adding technologies that gives our clinicians the ability to monitor them remotely, they can actually help them improve as they continue on their care process.
We're in the process right now of extending the reach of our medical oncologists. Down here we have 8 medical oncologists that are employed with our medical group. Very difficult for them to drive to a place like Richfield, Utah, who really wants medical oncology services, but there's no medical oncologist in the community. To get cancer care, they would either have to drive down to Cedar City or down to St. George or to Provo, Utah Valley Regional Medical Center. They can have their telemedicine appointment on screen with our medical oncologists. And they have a cancer-certified nurse up in Richfield who can do their chemotherapy, and those patients never have to travel. Some of those patients get interventions every day. So the benefit of having telemedicine reach across the miles to benefit patients in smaller communities is amazing.